The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. This week we've been talking about mental health, how people cope, and ways you can get help. The CDC says more than 50% of people will be diagnosed with a mental illness or disorder at some point in their lifetime. Tonight, we put mental health and treatment in focus. Joining us now is McClain, a clinical therapist at Retreat Behavioral Health. Thanks so much for being here.
Thanks for having me.
Lauren, the stats from the CDC are pretty startling that more than half of the population will at some time in their lifetime have a mental illness or disorder. Is it getting worse, or are we just getting better at diagnosing it?
We're definitely getting better at diagnosing. The earlier we diagnose, the better the outcome. But I definitely think that over the past year and a half, we have seen an increase in mental health illnesses and struggles.
Is that because of the pandemic?
Yes, I believe so.
How has that impacted people from your eyes?
I think from the start of the pandemic, the isolation has really taken a toll on a lot of people, not being able to have access to their loved ones, their friends, their support, not being able to engage in all of those self-care and enjoyable activities. So that has definitely, I believe, caused the increase in the mental illnesses that we've seen over the past year and a half.
And did it affect people, obviously in different ways, but maybe people who never had any problems in the past?
Yes, I do believe that we are seeing that also. A lot of people would engage in a lot of activities that they maybe didn't realize they were using as an escape, and being stuck in home for a year and being able to have that time to really sit with your thoughts and feelings, I believe has really triggered some mental struggles for a lot of people.
What kinds of things were people using as an escape, do you think?
I think just being busy. One of the trauma responses that we see a lot of times is people being busy, going here, doing there, never really giving themselves a chance to sit. And I definitely think that with the forced isolation, people, had a good chunk of time to really sit with their thoughts and their feelings that they had never had before.
Sometimes that can be a little scary, I guess, for people.
It can.
We all experience anxiety or other kinds of things like that at times in our life. How do you distinguish that from a mental illness or disorder?
Everybody, is anxious about things, can have periods of sadness, but it's really when they don't go away or they really start affecting your ability to function in daily tasks. That's really when it's important to reach out and get professional help. Just so that those symptoms don't interact with your ability to function in daily life. It's really when they don't go away on their own and you need that next level of support.
I guess that's a tough step for people to take, to say, oh, I do need help.
It can be, absolutely. And I would just encourage everybody, reach out to family members, loved ones, doctors, even your insurance company can help get those resources set up for you.
I imagine a lot of people don't want to admit to that. Some people see that as a sign of weakness, admitting you have a problem.
Yes, there is definitely still a stigma surrounding mental health and, needing some support from professionals. But again, the earlier that it's caught, the better the outcome. We can teach everybody skills, and there's medication management that when working together in that combination, people can really see the benefits of it.
So it really can help. Well, hold that thought, because we're going to talk more about those skills and some of the treatment that you deal coming up. We'll also grab a pen and paper, because we will have some phone and text numbers if you do need help.
This is WGAL 8 in Focus. Coverage you can count on.
There are resources if you do need help. The State Support and Referral Helpline is 855-284-2494. And here is the crisis text line. Text PA to 741741. And later we'll have phone numbers for county programs in the Susquehanna Valley. And we're again joined by Lauren McClain, a clinical therapist at Retreat Behavioral Health. Thanks again for being here. Lauren, you mentioned some of the skills that a counselor like you can help people develop who are having mental health issues. Tell me about some of those.
Sure. A lot of times we use something called CBT, which is cognitive behavioral therapy, or DBT, dialectic behavioral therapy. And a lot of both of those things offer the patient skills that they can use while in treatment and also when they get home to really help focus on changing, or what we would call untwisting, their thoughts and being able to be more in control of not allowing their thoughts and their feelings to control their behavior.
I imagine that's sometimes for some people, all they're thinking about is the problems they have.
It is. And a lot of times what we like to do with our patients is really focus on them being able to separate the distortion or like an intrusive thought to the truth and reality. A lot of times with depression and anxiety, there can be this skewed sense of reality, this story that their mind is telling them that's really causing a lot of the depression and the anxiety symptoms. And by using those two different techniques, really encouraging them to separate themselves from their thought or their feeling.
Interesting. For someone who's never been through counseling or therapy, what's it like? I mean, how do you approach a patient?
The first part is definitely rapport building. You know, anytime you're going to go in and talk to somebody, you want them to feel, you yourself want them to feel safe. You want them to feel like they are in a space where they can heal at their own pace, in a safe environment, non-judgmental. So definitely the first thing is rapport building that trust so that the client or the patient feels safe with us. And then from there, you know, guiding them through their struggles and pairing the appropriate technique and skills so that they can, once they leave the office or treatment, they can use those skills on their own to really help ground themselves so they experience less symptoms.
Well, let's talk a little bit about young people and how they experience mental health illness and conditions. Of course, people of any age can help to have these mental health concerns. And according to the most recent Pennsylvania Youth Survey, 38% of Pennsylvania students report feeling sad or depressed most days. That's up from almost 32% in 2013. Does that surprise you, Lauren?
No, not at all. You know, I think today with social media, and just the different like entertainment outlets that our youth has access to today can really be the cause of a lot of mental health struggles. You know, cyberbullying, again, like I said, social media, you know, just this pressure to be perfect and look perfect and do perfect things can put a lot of pressure on our youth today, which definitely increases their symptoms of anxiety and depression.
So what should a parent or guardian do if they recognize some of these symptoms in a child or adolescent?
Definitely reach out for help. You know, your pediatrician is a great place to start. Like I said, you can call your insurance company. There's lots of different resources out there for children and adolescents today. Psychology Today is a great resource when you really don't know where to go. You can just pop on that website. You can put in your geographic location, your insurance, whatever the mental health issue that you are struggling with or that your child is struggling with, and a list of providers in your area that take your insurance will be provided to you.
And I imagine probably the worst thing, or one of the worst things to say, is, you know, snap out of it. You're fine.
Yes, you know, I always say if they could, they would. Yes, definitely telling somebody to just snap out of it can be very frustrating for the person struggling.
It's hard for the people around someone with a mental health illness or disorder, isn't it?
It is, yes. It can absolutely take a toll on loved ones and family members. A lot of times we hear family saying that they feel powerless and helpless just because they want to do everything that they can to help their loved one or their child not feel so bad. They want to take that pain and that hurt away. And not being able to really do anything can be a very tough place for family and loved ones to be in.
Well, thank you very much for your insights. And coming
Thank
up
you.
on WGAL 8 in Focus, we'll speak with a woman who's been diagnosed with 2 mental health disorders, one that was triggered by trauma and how it affected her family. And we'll have some phone numbers if you need help in your county.
This is WGAL 8 in Focus. Coverage you can count on.
Here are some more phone numbers if you do need help, and we'll have the numbers again in just a few minutes. I know there are a number of them. And joining us now is Tanya Ruhl of Lancaster County. She's been diagnosed with complex post-traumatic stress disorder and bipolar disorder. Tanya, thanks so much for being here and sharing your story.
Thanks for having me.
I know the first diagnosis you experienced was the bipolar disorder. How did that come about and when?
I was about 27 when I was diagnosed with the bipolar disorder. I had a lot of ups and downs. There were signs of it probably as early as my teens, I would say. I did random things. There were times where I wouldn't sleep for days. There were times where then when I would crash, all I wanted to do was sleep. I would get ideas into my head and I would just go out and do them without any recognition of the consequences after. And I would just have these patterns over and over and over again. It finally came to a head, and my mom actually is the one who led me to say, hey, maybe you should see somebody about this and see what they have to say. And that's what led me actually to go seek somebody and see what they had to say. And that's when I was diagnosed with the bipolar disorder.
What was it like to finally get a diagnosis for all of that?
I had mixed feelings, honestly, because growing up, I grew up in a very, in a family that was religious. So, growing up, a lot of times it was, let's go to counseling, praying should be able to help. And I never understood why it didn't help, because I really wanted it to. So then when I got this diagnosis of bipolar, then I had this, well, why is my body attacking me? So I had mixed feelings. So it was weird. It was a weird sense, but at the same time, it was a relief because I had an answer to what was going on.
I imagine so. Let's talk now about the complex post-traumatic stress disorder, or PTSD. How did that come about?
That came about due to I was the victim of an armed robbery in 2013. I went back to work actually the next day. I worked every day after that I was supposed to for 6 months. And then it was like a switch flipped in my brain. And what I say is I broke. I locked myself in my house for 6 months. I didn't want to go anywhere. I didn't want to do anything. I really struggled with even taking care of my kids. I struggled helping out around the house. And then again, 6 months later, it was like another switch in my brain flipped. I looked at my husband and I said, I think something is really wrong with me. I think I need help. He obviously agreed because of everything that had been going on the past 6 months. We went to my family doctor and they led us to where I needed to go from there to receive help for that.
Wow, you've been through a lot, huh? I'll say. And it turns out, I know you have told me that the complex PTSD was triggered by this trauma, this armed robbery you were a victim of, but related to an earlier time in your life.
Yeah, I mean, the reason it's considered complex is because it's related to traumas that I have been through all of my life. That basically what I did is I just stuffed all the traumas instead of dealing with them, as a lot of people do, through either counseling or other ways. I didn't deal with them at all. And I just, constantly basically just shoved them down and didn't deal with them. And they basically just compounded one on top of each other, on top of each other, on top of each other, on top of each other until the armed robbery. And then basically that was kind of like the straw that broke the camel's back, so to speak.
Wow. Well, as I said, you have been through a lot, but we'll continue our conversation. We'll talk about your treatment and why you want to talk about this and tell others. And again, we want to show you those phone numbers, so if you do need help, you know where to find it.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Tanya Ruhl of Lancaster County. Tanya, you mentioned after this armed robbery and then you were holed up in your home for about 6 months, you finally went and got help and got this diagnosis of post-traumatic stress disorder. What finally, as you said, the straw that broke the camel's back, but what made you go and get that help, and what kind of help did you get?
Well, I realized how much of an effect it was having on my kids. I wasn't able to be the mom that they needed. The night terrors were awful. I wasn't getting any sleep. And I wasn't obviously being the wife that my husband needed as well. The help that I was getting was amazing, actually. It was called prolonged exposure therapy. While it was extremely hard and difficult, is the best way I can describe it. And I know that sounds really weird when you talk about a therapy like that. It was extremely helpful. It was tiring. One session would really wipe me out, especially at the beginning, but it's well worth it. I'm very glad that I went through it. If it weren't for that, I wouldn't be where I am today.
So this focused on the early childhood trauma that, may have triggered all this, and then the armed robbery came along?
No, it actually started with the armed robbery. That's where the focus was, because that's basically what led me to therapy, was the armed robbery. So that's where the main focus was. And then through that, it would trigger like memories of past trauma that we could then work through.
Why do you think this is important to talk about? This is very personal, and why do you think it's important?
It's important to talk about because it helps end the stigma that mental health is something to hide, because it's not something to hide. If you hide it, then people don't get help that they need. And it's not something to be ashamed of. It's a part of you, and it's a part of you that, while, yes, it's not perfect, you can get help to be able to function, to be able to do the things that you want to be able to do. I'm able to hold a full-time job now because I got the help that I needed. I'm able to go out and watch sports with my kids. I can be a mom now. I can be a wife now. I can do all the things that I wasn't able to do those 6 months that I was locked up in my house.
So that gives people hope. There is hope, even if you're feeling like there's no hope.
Yes, there's absolutely hope.
Why do you think there's so much stigma around mental illness?
Because it's something that's not perfect. And I think in this day and age, there's so much in magazines, in billboards, in everything that you see nowadays, that you're supposed to have this, this perfect look, this perfect body, this perfect image. And if you're not that, you're not good. You're not good enough, and mental health is part of that. If there's one little bit wrong with you, you're not good enough. And that's part of the stigma of mental health. And unfortunately, that's just wrong, and it's not right. And that's part of the reason why I try to speak out about it as much as I can, because I have bipolar disorder. I have CPTSD, but I'm functioning. I'm able to hold a full-time job, like I said. Do I have my bad days? Absolutely. I do have bad days, but that's okay. I get through them. I talk about them. I reach out to the people that I need to reach out to, whether it be my boss, my husband, my friends, and I get through them, and it's okay.
Well, we are certainly glad you were okay, and thanks so much for sharing your story. It's really compelling.
Thanks for having me and letting me share my story.
I know we gave you a lot of phone numbers tonight. If you missed them, we have them at WGAL.com. Our coverage of mental health continues on Sunday. We're airing a program from our sister station called Chronicle, The War Within. More people sharing their stories of living with mental illness and how they're able to cope. That's Sunday afternoon at 12:30. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus after NBC Nightly News.